Hello, everybody, and welcome to my very first virtual childbirth education class. I have been wanting to start a YouTube channel for a while, and I just haven't because, had all these other things to do, but now that I am staying home and keeping healthy and following the orders of the mandate that we were given Friday, I have all this extra time now. So here we go, my very first actual video. So before I get into the juicy stuff, I'd like to just talk a little bit about what we're going to be talking about. So I actually had a request last night from a mom saying that she has been having really bad lower back pain around the sacrum and the coccyx. So this is pretty common in pregnancy, and the reason why is probably pretty obvious. You are carrying a baby in the front part, which overextends our front, and as a result, our back tightens up. And it especially tightens up around here. And it can definitely cause what you may refer to as a locked sacrum. So during pregnancy, and especially during childbirth, we would prefer to have an unlocked sacrum, a sacrum that can freely move. And this is because as the baby passes through our pelvis, we don't want the sacrum to be blocking its head. We want the baby to be able to come out. And there are definitely ways to give birth while laying down and still encouraging that sacrum to be freely moving. And so that's, if you're towards the end of your pregnancy, about 30 weeks plus, and you're having that lower back pain, it could be because you need to start loosening up those ligaments and muscles around the sacrum and in the low back that can help you open up the first part of your pelvis. And not only will this help you with pain, it will help you. It will help your baby engage into your pelvis if you have more of this balance in that area. It will definitely help with the first part of the labor and childbirth process. If your baby is nice and snug in your pelvis, you don't have that imbalance in your low back sacrum area. So yeah, we'll talk a little bit about that. And I'd like to just kind of show you a little bit what that looks like so you can visualize it. If you don't have a birth ball or yoga ball, I highly recommend getting one. A lot of hospitals and birth centers have been adding these to their labor rooms, which I think is awesome because they're so helpful. Even if you're early on in your pregnancy and you're having pain, definitely recommend getting one of these. If you do a lot of office work, you just sit around a lot, it's always good to have a ball. When you're on the couch, we tend to kind of slouch and get squished, which is not good for our bodies. If you're on a ball, you're in a nice balanced position, you can bounce around, which also helps get the baby down into the pelvis. So, just so you can kind of visualize things. So what we're talking about here, about opening up the superior opening of the pelvis, if you can see how my pelvis is sort of situated right now, I'm a little bit flared to the back. So this is opening up the bottom part of my pelvis, which is better for the actual delivery of the baby, for the baby exiting our body. But to get our baby nice and snug in the top part of our pelvis, we're going to want to have the opposite kind of a movement. So more like this. So if you can kind of see the cat-cow movement and visualize what your pelvis is doing. When our pelvis is like this, you can almost see how the bottom part of my pelvis is open. But when we go like this, the top part of our pelvises are open. So towards the end of your pregnancy, and even in the early stages of labor, you're going to want to encourage the upper opening of your pelvis to remain open. And to do that, we need to loosen up these muscles in the back. And there are many ways to do that. Of course, yoga helps, massage, but of course at the moment, many of us are abstaining from that kind of work. So I'm going to teach you a little bit about how to hopefully loosen that up on your own without having to go to a body worker. And if I had a body with me today, I would love to show you guys some massage techniques, but I do not have a body with me today, so I'm just going to show you just some things to get things moving. And a little bit more on the anatomy front of things. I feel like it's important. I like to kind of explain the whys of things because it just interests me so much, and I hope it's not too boring for you guys. But if you can picture your body in quadrants, so we have our frontal plane, and that at the moment when you're pregnant is what's being overstretched, and that's why we have the diastasis recti, because we're just being so opened up in our front, right? Our bellies are open, our hearts are open, things are just opening here, and it's what's supposed to happen. So it's good, but at the same time it causes a lot of pain, right? So just to encourage that balance, we are going to want to focus on opening our back plane. So if you can picture your body as a front plane and a back plane. Front is open, our back is starting to contract, it's starting to become closed. So we want to create that balance. We're not necessarily trying to close our front, because that's not what we're doing, but we're just trying to get a little bit more movement in here so that we're a little bit more comfortable, and we're trying to create a balance here, a fascial balance between the two planes. So how do we do that? Well, my favorite way, and I hope most of you do have a ball. If not, you can definitely do this on the floor, and I will show that next. But first I'm going to show it to you on the ball, because I love balls. What can I say? Sorry, that was a very naughty joke. Okay, so here we are on the ball. And it's super simple. I mean, just getting that movement in the pelvis. See how I'm moving back, moving forward, adding the neck into the work, adding the shoulders, just really trying to create movement throughout your whole body. And then go the other way. And then just moving back and forth, and really including the whole body with this movement, because even if you're only feeling the stretch, say in your foot, the bottom of your foot, it's still affecting the whole fascial line. And I can show you a little bit more about that after we go over this ball exercise. So this technique is probably going to be one of the most important ones you can do, because it's just so easy. You're on the ball, and you're in a good position. So just really play with it. Feel comfortable doing it. Don't try and force your body into doing anything. Just really make it your own movement. Whatever your body wants to do, whatever you feel is right. You do the figure eights, all sorts of things on the ball. This ball makes any movement multidimensional. My personal favorite is really just doing circles. And you could do this while you're on the computer, you can do this while you're watching TV, you can do this while you're eating dinner. And these balls are also great for when you're postpartum. You can hold your baby. This is great for posture. It's great for calming the baby, because babies like to be bounced, right? So you don't have to be bouncing while you're standing up. You can be bouncing on the ball. It doesn't take a lot of effort. So that is my number one exercise that I can show you that I think is really great for unlocking the sacrum. And really the intention of this is to create a freedom of movement in the sacrum. So we're not just holding like that, then holding like this. What makes these movements so great, and what I really recommend, is to create it as a somatic movement. So what's a somatic movement? A somatic movement is not when we go into a pose and we hold it. It's when we go in and out of a pose, so we're not stuck in one position. If you can imagine a dog, or even yourself, when you wake up in the morning, probably one of the first things you do is stretch, right? And then we come back. So we're taking our muscles to a very good point, right? And then we're bringing it back down. We're not holding ourselves up And then we're not holding it like that for 5 minutes or however long. We are just doing a gentle, nice opening and closing movement. And that's what makes it a somatic movement versus a normal kind of a movement where we're holding something for a long time. So when you do these kind of movements, I highly recommend going the ins and the outs, openings and the closing, and not holding in one position for too long. So saying that we want to encourage that flatter back, that's not saying that we want to not do the other movement, right? We don't want to just walk around like that because that can cause issues as well. We want to just make sure that we have the movement, that you have the freedom to do that. Does that make sense? I hope it does. Okay, another really great thing to do. So, we were just talking about the fascial lines and about how even just doing a little bit of work, say down here on the fascial line, can have an effect on the whole entire fascial plane. So, another great thing to do, and this is even recommended in Spinning Babies classes, is to take a foam roller. You can even do this on a wall or maybe a stack of books. You can get creative with this. And I'm using a stool. Is just to have your foot like this. I have my right foot on the stool, and I'm leaning into that, and I'm feeling a stretch down my entire right leg here. And if you're tight enough, you may even feel this all the way up to your neck. So to really get into this pose, I'm going to stop talking for a minute, and I'm going to just gently bring my chin down. And I'm also going to encourage that flat back kind of a movement as well. I was doing this earlier and I felt a little adjustment in my low back. And come up, make it more of a somatic movement. Go back down. So this is a really gentle way just to open up the whole back line. Really great way to do it. You might even want to do that before you go on the ball. Do that on both sides to just really encourage a gentle opening of that back line. Okay. So those are two really great ways to encourage those muscles and those ligaments just to relax around the sacrum and the coccyx. This is another really great one. If you're happy with those two, then maybe those are the two for you. If you want to take it up an extra notch, then you can go ahead and try this one. This is one of my favorites. So, what you do is you go down into a bridge, maintaining your knees up, of course. Now as you're laying on the floor, before you go up into the bridge, I want you to bring your awareness to your lower back. Now, right now, I can feel my lower back not on the ground. And that's normal. It's normal to have a little sway in the back. But when we start this movement, we are going to tilt the pelvis so that we feel our lower back on the ground and slowly lift each vertebra by vertebra all the way up to your neck, and slightly tuck your chin in a little bit. And push your shoulder blades into the ground. And then slowly go all the way down, vertebra by vertebra. Until you reach your coccyx, and then push the coccyx into the ground. And then come back up. This is what makes it the somatic movement, because we're not holding it in one specific position the whole time. We're creating movement in the spine. And as you go down vertebra by vertebra, you're relaxing those ligaments and those muscles all the way down the spine, especially in the lower back. And in the end, pushing that low back and coccyx into the ground. And that's what I recommend doing daily. I love that movement. It just releases everything down along the spine. It creates that movement in there. And yeah, that's one that I really love. I did it in my pregnancy. I hope you can do it in yours too. So, yeah, those are my top 3 recommendations for dealing with that low back pain towards the end of your pregnancy, and even in the beginning. I mean, you can do, those are safe movements to do throughout your entire pregnancy. And really, the sooner you start, the better. The sooner you start unlocking the pelvis and unlocking the sacrum, the better. You're not going to be 20 weeks and say, oh man, why did I unlock my pelvis so early? No, you're gonna be glad that you did it. The sooner you start, the easier it will be to maintain it throughout your whole pregnancy if you just keep this up. And yeah, as far as massage goes, I think I probably need a body to demonstrate. But a few pointers about massage. If your partner is massaging you, my recommendations would be to firstly, of course, be in a sideline position. So how you can do that, you'd want to have 2 pillows under the head. About 2 pillows under the head, 2 to 3 pillows under the leg and knee, maybe even a pillow for your torso, and a pillow to hold on to like that. So this puts you in a really great position. And the reason why I love this position so much, and a few of you might have heard me praising this if you've worked with me in the past, but it really encourages the freedom of movement in the sacrum. You're not stuck in a position like that. Your pelvis and your sacrum is free to move, and all the good stuff is right here, right? All the stuff you want worked on is right there. They don't need to go searching for anything. It's all laid out here. And the coccyx is easy to access as well. The SI joint, at least, is super easy to get into there. I wish I had a pelvis here to show you guys exactly what that looks like. But, yeah, the sacrum and the coccyx are obviously extensions of the spine. So that goes down the middle, all the way down to about the bottom of the spine. And then you have the pelvis. That kind of comes up like a curve this way. So there's that little space of ligaments in between the sacrum and the coccyx and the pelvis. And that's where all the juicy stuff is. It's really juicy in there. That is, if you are a partner watching this and you're wondering how to help your pregnant partner with their lower back pain, go for the gold. Just go right there. It's all good. They will like it. So, a couple tools you can use. The thumbs are good. Just make sure that you're using them properly, using your body weight. Your knuckles are really great to use. You can have one thumb in there and just kind of shake the hips a little bit. Yeah, a lot of these things are just better to show you on a person, so I hope that the next time I make a video, I can have a body here to show you on. It might be my partner who is a man, so maybe, I don't know if that would be okay with all things considered. I can't really just invite pregnant women into my office at this point. But yeah, I hope by next time I can have a body here and I can be showing you some really cool massage tricks, because we've been using massage since the dawn of humanity to help with these aches and pains during normal life, during pregnancy, during labor, and postpartum. And obviously I love massage and I love the benefits, but until that time, until you can get into a chiropractor or see a body worker, or maybe your partner is just a little not too comfortable with giving you a massage, hopefully those movements can provide you with some kind of relief until that point. Yeah, so stay well, stay balanced, and thank you for watching my video, and I hope you like it.